I'm Adam Wheeler. I'm a pediatrician for Tiger Pediatrics, and I've been practicing in Columbia for 2 years now. Yes. So there's a little bit of concern about flu mist because it's a live virus, and so there are certain conditions that if they exist in the family, you can't give the flu mist, and you have to give the inactivated flu vaccine, but pregnancy is not one of those. So that's like people that are on chemotherapy that are living in the house with the patient. We would not give them the live flu, the inactivated flu vaccine. We'd give them the killed version, the shot. So you can get the flu shot down to age 6 months, and then you can get the flu mist down to age 2. If it's your first year you've had a flu vaccine, you have to get 2 instead of 1, about 6 months. We recommend it. It's recommended by both the American Academy of Pediatrics and the Centers for Disease Control. Influenza is still one of the leading causes of death in kids. And in 2011 in America, anything that can save a life or potentially save a life is a good deal. So we know that kids that get the flu vaccine are at decreased risk of death from the flu. And so, yeah, we recommend it. They don't have to anymore. So this year it's all in one shot. So the regular flu shot this year has in it multiple strains of flu, including H1N1. Most kids get flu do fine. You get 4 days of high fever, runny nose, muscle aches. Kids are crabby. Some percentage of kids will get an ear infection after the flu, which is obviously painful but very treatable. Every once in a while, though, kids get a serious infection like pneumonia. And I can think of a couple patients that I've taken care of over the last year that almost died from complications of the flu. And again, in 2011 in the United States, death is not something that we should be dealing with. And so anything that could potentially prevent that is a really big deal. There are a few real side effects. Shots hurt. The flu mist gives you a little bit of a runny nose for a few days. The flu mist is live flu, but it's been fixed so that it can't exist at body temperature. So it can only live in your nose. So it gives you a full case of the flu except in about that much of your nose. And so your body learns to fight the flu, but you don't get more than a slight runny nose. Those are the real side effects. I think the real reason parents don't give it is the fear of the unknown. And this fear of, is there something in there that we're going to figure out in 30 years was causing harm to people, and that we're going to wish way down the road that we weren't doing the vaccine program. The vaccines are one of the safest substances known to mankind. They've been tested more than many, many other things on the market that we commonly take for granted, just because of these concerns that parents have. And so, I have 3 kids. They get all their shots right on the CDC schedule. They've all gotten their flu vaccine each year. So I'm a big fan of vaccines, including the flu vaccine. They certainly save lives. And that fear factor is the thing that really gets people concerned. And we do our best to try to reassure parents. But in the end, the way statistics work, I can only say there's less than a 1 in a million chance that something bad will happen. It's impossible to guarantee anything in this world. A few years ago, there was a study that came out that suggested a connection between vaccines and autism. That potentially the measles vaccine, which we usually give at 1, was the cause of autism, and that was proven to be falsified research. So the guy actually faked the study for profit, and it's been subsequently discredited, and he's lost his medical license and lots of other things. But it's probably one of my number 1 questions is, are these vaccines going to give my kids autism? We don't know what causes autism. It's a horrible condition, but we know the vaccines don't because we had to spend millions of dollars proving that guy wrong.